look at this graph. I use it a lot in my clinical practice with patients, often at the beginning of their endocrine treatment. And what this is it's a meta-analysis. So an analysis of 100 trials, over 10,000 patients who have received endocrine therapy, in this case with tamoxifen or placebo, for about 5 years. And what I tell them is that, okay, so you see the number of years across the bottom and the percent recurrence on the vertical axis. And so you can see that between years 0 and 5, there is a difference in recurrences between the tamoxifen treated group, which is the light blue on the bottom, and the placebo group, which is the dark blue on the top. Recurrences are higher in those patients who were treated with placebo. But what's really interesting about this is that over time, you stop taking tamoxifen at 5 years, and at 10 years, you can still see the difference. There's just as much of a difference. And at 15 years, you can see the difference. And that difference is still large. So when I speak to a patient about this, it's that our decisions that we make right now affect your rate of recurrence and mortality 15 years from now. And in this way, a lot of patients decide that, yes, it makes sense for me to take tamoxifen in the first 5 years. But what this also shows us is that the risk of recurrence doesn't stop at 5 years, that it continues 10, 15 years, and even 20 years. And so I've had patients point this out to me. And, the reality is that half of the recurrences occur in the first 5 years, but the other half occur after 5 years. And so there's no celebration at year 5 where a patient with estrogen receptor positive breast cancer can say that they are disease-free for the rest of their life. So we need to make decisions to try to change that over the years. So if the hormone blocking therapy can do a really good job in the first 5 years, why not extend it? And then we can see that further on, there are fewer recurrences at years 10 and 15. And so, yes, we can do that, but we know as practicing clinicians that this comes at a cost, and there are side effects that are associated with extending therapy, and that even while therapy will benefit some, about 1 in 5 patients, most of them, 80%, will not benefit from this extension of therapy. So we need a better way to decide who's going to recur and who's going to benefit from extending therapy.